A few weeks ago, when we scheduled this strike, we called Patrick, and without hesitation, he said he's coming. So let's give a warm NUHW welcome to Patrick Kennedy.
Thank you very much, Sal. Thank you all for the standing ovation. I am really grateful to be here. I've been fighting for this cause my whole life. I grew up in an alcoholic home, always trying to hide my mom from anybody who was visiting the house, always trying to look past my father's post-traumatic stress, always trying to get answers to how my grandmother on my mom's side died and never getting them. I know about silence. There's a phrase in recovery, and I'm a person in long-term recovery, that says, we're only as sick as our secrets. Yeah. And what you're doing out here today is telling on what's going on here at Kaiser. You're making sure their secrets are being told to the wider audience. And I might say, what you're doing is not only addressing this on behalf of your patients who are trying to get care in a timely manner here at Kaiser, but I'm here to tell you, you're raising an issue that is being largely ignored around our country. Yeah. We have a public health epidemic in our nation. And you would expect rallies like this all over this country when you consider the number of our fellow Americans who are dying of these illnesses. And you know what's happening? We aren't getting those rallies. We aren't getting those turnouts. Why? Because of stigma and the shame that accompanies those who seek treatment for these illnesses. And because those who are well enough to live in recovery, many of them confuse the 11th tradition of 12-step recovery to mean that they're supposed to stay silent in the church basements as opposed to come out and tell their elected officials what they expect them to do on the issues that affect them personally and everyone that they know personally. And of course, because so many of your colleagues are independent practitioners who are getting discriminated every day in terms of wages and benefits, and who are not included in the system at all, but don't have the backing of a great union like NUHW. I don't know of another union in this country that represents and works on behalf of those with mental illness and addiction like you guys. There's no one else out there that I've been able to find, and I travel the country on this issue. So I want you to take great pride in what you're doing today, because I know it takes a lot out of you personally to sacrifice your time and energy and dollars to stand out here on behalf of your patients. Because what you're asking for is no more than equity in the way that you are treated and provided for as a clinician, in the same way as if you were treating any other illness that's being treated in the building right behind me. So I never expected to be a voice and a champion for mental health and addiction. That was not my goal in life. It wasn't until the guy that I went to drug rehab with sold his story to the National Enquirer for $10,000, telling everybody what it was like to be in drug treatment with me, that my life changed. And I have to say, I thought it was the worst thing to ever happen to me. and I thought that it would mean the end of my political career. But what I realize now is that it was the best thing that ever happened to me, and it was really the beginning of my political career, because I went on to get reelected after that. So Sal will appreciate this. I represented the most Italian-American community in the country, okay, in Providence, Rhode Island, all right? And when this guy sold his story to the National Enquirer, and I thought I was done, I went to my mentor in the Italian-American community, who had endorsed me and brought his whole community on my side when I ran for office. And I'll never forget his words when I went into his house and he had to turn around and I had to face him for being the drug addict that I was. And he said, "Patrick, that cagoots," he said, "you want to know something? That guy's a rat bastard." And then he said something I'll never forget. He said, "Patrick, you want me to do something about this?" And I said, "No, Frank, I appreciate the show of love and compassion." And so I ran my next election with "Vote for Patrick, not the rat bastard." And I managed to win. I went on to Congress as the youngest member of Congress. And I'm sure that had, 27 years of age, elected to Congress. I'm sure it had nothing to do with my last name being Kennedy whatsoever. It was my good looks and personality that got me so far in politics. So I got elected as the youngest member, and the reason I mention that is I was also from the smallest state in the country, Rhode Island, and in the minority party. And yet, I got to put my name as number one, as the chief sponsor on a piece of legislation that said that the brain was part of the body. A radical notion, the brain. But it took Congress another dozen years to debate that idea as to whether the brain should be reimbursed like any other organ of the body, and whether we ought to treat brain illnesses like we would any other set of illnesses. So the law eliminated higher co-pays, higher deductibles, lower lifetime caps, and higher premiums. It also, more importantly to this strike, said that you had to have equal access to care. And it said that it had to equal access whether you're inpatient in-network or outpatient in-network, or inpatient out-of-network or outpatient out-of-network, or you needed pharmacy benefits or emergency room benefits. They had to be analogous across the primary, secondary, and tertiary levels of care, as would be the case if you were receiving care for cancer treatment, cardiovascular disease treatment, or diabetes, or any other number of illnesses. And it's nothing more simple than stop discriminating against patients because their illness is an illness of the brain. And what it did is the modern day equivalent of what the civil rights laws did in the 60s, which I am honored to say my late uncle, President Kennedy, was the first president of the United States to address the moral issue of his time, civil rights. And he went on national television when no other president ever did, and he said that this was essentially a moral issue. And he said, who amongst us would trade the color of their skin and be content with those who counsel patience and delay? Because you see, back in the 60s, many people were saying to President Kennedy, don't push this civil rights issue. Take your time. It'll happen over time. And of course, thank God he stood up, and then thank God that bill got passed. because we're not over racism in this country. But what we cannot allow people to do under federal and state law is practice their racism. In other words, we can't change their thinking, but we can change their actions. And that is what the Mental Health Parity and Addiction Equity Act is about. We're never going to get over the stigma, really, for another generation. I think it's going to take before we fully address this as part of overall health care and not something different. But until that time comes, we need to normalize mental health and addiction treatment as part of overall health care treatment, and we need to make sure people do not feel that their illness is their fault. And too many people do feel like it's their fault, and they have a tough time even asking for help in the first place. And so, what is Kaiser thinking when it's tough enough to walk that line and say, yes, I need to finally address my mental illness and addiction that's affecting me, my health, and the life of my family and friends. And then, to make it difficult for them once they've chosen the path of recovery, to make it difficult for them to actually gain recovery because of the inadequacy of available treatment, because there's insufficient workforce in order to meet the need of those who are asking for help. So, what we are doing with all of you is to try to get this parity registry, which is frankly called don'tdenyme.org. You can Google it after you leave here or when you're marching around. Don't Deny Me, shouldn't be hard to remember that, don'tdenyme.org, because it'll allow us not only to get people expedited appeals, because we make it easier for people to file appeals, but more importantly to me, in changing these pattern and practices of discrimination, we need to get political, and we need to get real families, real patients who are willing to come out of the shadows and go and see your new Governor Gavin Newsom and say, here's my situation. Or go and see your Attorney General Javier Becerra, a good friend, and say, here's what we're experiencing. All we need are a couple of dozen families from across this state with compelling stories who can talk to the difficulty in accessing care. And I am telling you, that is going to require them to investigate. Because at the end of the day, they're not going to care about this. What they're going to care about is what this produces. And that is the phone call from the AG's office or the insurance commissioner's office or the speaker's office or the governor's office or Speaker Nancy Pelosi's office that says, what is going on over there? Because we're getting complaints. And what the insurance commissioners never get are these complaints, and they never investigate on the health plans that are doing business in their state because, as you know, too few people come forward and are willing to tell their stories. So we need your help in getting your patients to be comfortable with telling their stories as a way of helping not only their own situation, but that of others that will come after them. Because invariably we know these illnesses affect families, and they run in families, and if we want our families to get a better deal in the future, we have to work today so that they have a better tomorrow. So I just want to say to all of you, you know, it is so important that you're here as organized union members. The fact that you've got so many of the affiliate unions here to support you is terrific. You know, we need that kind of spirit in this country more than ever before. More people in America are suffering because they're suffering in isolation. They are more connected technologically and less connected humanitarily and with others of their brothers and sisters. But in organized labor, that's not the case with all of you. You work together, you care about each other, you call each other sisters and brothers. It changes the culture, and that is the kind of culture we need more of community in this country. And so, you know, Martin Luther King said we are all caught in an inescapable web of mutuality, tied in a single garment of destiny. What affects one directly affects all indirectly. And he went on to say, injustice anywhere is a threat to justice everywhere. And he was following in a long history of those who are trying to change our country's whole attitude around race. And Frederick Douglass, who was another great champion for abolition and civil rights, said, power concedes nothing without demand. It never has and never will. We won't get the changes that you want in this healthcare system if you don't demand, because it's just reality. People don't change because it's the right thing to do. They change because they have to change. And we didn't wake up one day and say, wouldn't it be nice if we treated each other like sisters and brothers and eradicate racism. It was only because people marched on this country to change civil rights laws that we ended up getting them. It was tragically only after things like Selma, Alabama, that we ultimately got the Voting Rights Act. So it's really about political action, social protest. That's what's going to really make the difference here. And that's why what you're doing is so very, very important. We need to look like the civil rights movement for case law and find out where our best chances of making changes take place. Because like civil rights, it's not going to happen as a monolithic change. It's going to happen in a few places and then spread to other places. What I'm trying to tell you is, even though you're here for an issue that affects California, what you're doing here could have a huge impact and ripple effect across the country. Yes. And I want you to understand that. And what you're doing here could also give us the playbook, right? Because frankly, Kaiser's not alone in their inadequate, in-network access to treatment. California Blue Cross Blue Shield ain't doing such a good job either. And we are facing more restrictive medical management practices when it comes to accessing treatment for mental health and addiction than you would see placed in the way of someone seeking care for cancer or cardiovascular disease or diabetes. There's just no two ways about it. There is more onerous medical management practices. And in addition to that, what is another violation of parity is the lack of adequate pay when compared to other specialties. And frankly, that is a parity violation because everyone today is complaining about, oh, there's a shortage in workforce. There's a shortage. Well, of course there's a shortage in workforce. No one wants to go into this field because they can't get paid a living wage. And what kind of reflection on our country is it when we have the biggest public health epidemic of our time, and yet we can't even pay the people who are the most important healthcare delivery practitioners in our country at this crucial time of record overdoses and record suicides and record rates of addiction and record rates of depression and anxiety. I mean, how could we make this up? That the people we need most in our healthcare system get paid the least in our healthcare system. So I appreciate that Kaiser wants to be the great thought leader in healthcare. But to think that they have you all standing out here, you know, just before the holidays, giving up your pay, simply protesting inadequate pay because of the very real problem that your patients are facing when trying to get access to treatment because there are not enough of you. I mean, how can they think of themselves as a thought leader when ignoring the most essential part of modern day healthcare, which is mental health and addiction? And this isn't just good political talk. This is good economic talk, because you know what? We know for certain that the more money you spend on mental health care, the more reduction in total cost of care that you get. We know that. And this isn't some, like, you know, study that's just an esoteric thing. It's being implemented across the country by all these other health plans who want to reduce their total cost of care because they're into risk-based contracts. And guess what they say? The more investment I make in mental health care, the total cost of care of cancer goes down. The more investment I make in mental health care, the total cost of cardiovascular disease goes down. The more investment I make in mental health and addiction, the cost of diabetes goes down. The more investment I make in mental health and addiction, the more reduction in emergency room visits go up. So why in the world would you want to be skimping on the thing that's bringing you more value than any other part of the healthcare system? It doesn't make any sense. So I just want to say to all of you, thank you again for giving me the opportunity to come out here. I hope that you all continue in this struggle, because as I said, it's going to be one that others will recognize around the country as really meaningful, and it's going to give them a template. And all of my friends in organized labor, we're going to need to work with them to get them to support broadening this struggle, because all of the big international unions can do a lot more in insisting that the third-party administrators who do business with the, you know, carpenters and the laborers and the firefighters and all the building trades, you go down the list, you know, they're not getting adequate coverage for their members because they're often not insisting with their third-party administrator that there's adequate coverage for their members in their workplace benefits package. And so this is what I'm saying, like, you're standing out here means a lot more than that. It allows us to galvanize the union movement to even itself step up on the international union basis and do more to focus on this, and also see it as an organizing opportunity, because, as I said, these healthcare workers everywhere could use more of you in order for them to do their job, and they might as well join you in common cause in the process. So I'll conclude and just say, nearly 8 years ago, on February 22nd, 2011, was the last time I used drugs and alcohol to solve my problems. And I left Congress because I didn't want to get kicked out of Congress. It was touch and go for me as to whether I would make it out of Congress without going out in a scandal. And I was blessed because I was able to leave Congress. I ended up leaving Rhode Island and going to a place I'd never been before in my life. And the only thing I started doing at that point was something I'd never done in my life previously, because I was feared up about my anonymity and what I might say in a meeting might get out of a meeting. I started going to 12-step recovery, and I went and I got a psychiatrist who was certified in addiction medicine, because not every psychiatrist and mental health worker really understands the nature of addiction as well. And I was able to do that and just do it, and do it slowly and one day at a time, and make time happen. I managed to get married and start having kids, and I never could have imagined that I actually would be getting back into this cause of advocacy. And so, you know, life is unbelievable in the ways that it presents you things that you never expected. So I just say today, I have 5 children, and if I stay in recovery and I stay close to this movement helps me in my recovery. You know, God willing, and I pray to God every day, God willing, I will be able to break the cycle of addiction in my family and make it so. And thank you, and make it so that my children do not ever have to see their father inebriated. And it's because of countless times that I went to treatment over the years from clinicians like you. In fact, I was at a event last week, and a woman came up to me and said, "I was your psychiatric nurse when you were at the Mayo Clinic." And I'm like, wow. I'm sorry, I don't recognize you. But when we're active in addiction and mental illness, we're the most unsympathetic bunch you could possibly treat. And so what that means is the work you do is beyond the normal, because it requires a certain spiritual dimension for you to be able to see through the illness of addiction, see through the illness of mental illness, and see the humanity in the person that you're treating in spite of their illness. That takes a special person. You certainly have not gone into this field for the money, I can say that much. But you've done it out of a sense of vocation. And I can tell you, I grew up in a family where I thought I had missed it because I wasn't there for the great marches of Dr. King. I wasn't there when my Uncle Bobby was there for Cesar Chavez when he was breaking the fast. I wasn't there for all of those great marches for social justice, but I am here now. And this, my friends, is the cause of our time. And you might not think it's going to change overnight, but remember what people in Cape Town, South Africa thought in 1966. They never thought they'd ever see the end of apartheid. And there my Uncle Robert Kennedy said, each time a person stands up or acts to improve the lot of others, they send forth a tiny ripple of hope. And coming from a million centers of energy and daring, those ripples can create a current that can knock down the mightiest walls of oppression and resistance. And what he was saying is it doesn't take one person to change the course of events. It takes all of us doing only what we in our own lives are responsible for, and that's do what we can to make a difference. So I want to thank you all. Keep working hard. Onward.